Cardiovascular disease specialist and founder and director of Apex Heart and Vascular Care. Welcome, doctor.
Thank you so much, Gianna. Absolute pleasure being here.
Thanks for being with us. So in terms of your practice, how have things changed over the last couple weeks, the last month?
Oh, dramatically, just like any other practice. So I'm a cardiologist and I have two predominant roles. One is taking care of patients in the hospital, and second, I have a large outpatient practice taking care of patients in our various offices. And everything and everyone is impacted. In the hospital, we are seeing much sicker people. We are seeing, now predominantly hospitals are converted into COVID-19 wards, like I think inpatient, and I go to 5 hospitals. Every hospital, 80% of the patients are right now either COVID positive patients or they're being ruled out. So we are dealing with a lot of COVID patients. Because of that, the actual care that we used to provide for our cardiac patients and our vascular patient has changed dramatically, and we still don't know whether it's for better or worse. And finally, as far as the office side of things go, things have changed dramatically. We are actually not seeing patients face-to-face in the office or doing testing in the office. We have 100% gone into telehealth.
And a big discussion around this whole pandemic has been the shortage of PPE here in the country. So what have you been seeing with that? What do you think needs to be addressed? Talk about that.
I think PPE shortage is one of the biggest examples of how, unfortunately, our administration and our leaders have dropped the ball. I think PPE shortage is real, it is brutal, and it's completely unwarranted. People keep giving analogy that this is a war and we are the frontline COVID workers. They're not getting the PPEs. I mean, this is supposed to be the most advanced nation in the world with the most advanced army, but also most advanced healthcare. Well, if we have the most advanced army and most advanced healthcare, how are you not giving the armor that our frontline COVID workers need? And people have to wear trash bags as because of lack of PPE. I think that's absolutely brutal. So I think the government, what we could do is at every level of organization, we could try to get the global supply chain moving, find out where these PPEs are produced and motivate people, the American companies to produce more than what it's already being done, and try to move the supply chain much faster. Get rid of the red tapes around it, change the laws if they need to. If private organizations can do it, for a doctor like me, if I post on my social media and somehow find 10, 15 N95 masks from somewhere, then larger organization and government should absolutely be able to do that.
And a question that we had from Facebook on the topic of the masks is the person was saying they know these N95 masks are for healthcare workers, but the government has said that we shouldn't wear the mask unless you're sick. But they're asking, wouldn't it help to flatten the curve if they wore something in case they did come into contact with someone? So what do you think about people wearing masks?
Yes, so I think in an ideal world, that would absolutely make sense that everybody wears masks and you can reduce the transmission and flatten the curve. Unfortunately, we are not living in an ideal world. We are far from it. And what's going to happen is if everyone, if the government makes a recommendation or CDC comes out and I think CDC is thinking about saying everybody should be wearing a regular mask. Even with that, I think the whole supply demand is going to get majorly mismatched. What may end up happening is these are tough commodities to come by, even right now, even for healthcare workers. And they're going to be even more tough for us to acquire those masks, especially the N95 masks. So I think as important and as intuitive it is that everybody wears a mask, we have to look at the data, and we have to rely on data. That's something which we haven't done successfully as a country. So I think we need to start relying on it, see what that's going to lead to. If general public start using this mask, it's going to be a huge shortage.
And thanks for that. Now, getting to your specialty, we have seen that people that have underlying health issues have been at risk of having more severe symptoms or reactions to COVID-19. So how does the virus kind of impact people that have heart conditions?
Majorly, so we always say that COVID-19 unfortunately impacts those who happen to have underlying comorbidities a lot more. So what are these underlying comorbidities? It's actually cardiac disease, people who have hypertension, people who have diabetes and already had blockages in the heart arteries before what we call coronary artery disease, people who have congestive heart failure, along with cancer patients, patients on chemotherapy, along with patients with asthma, bronchitis. These are the sick people in our society These are patients who are walking in and out through my office. These are the folks who are unfortunately most vulnerable to COVID-19 in terms of getting the infection. Not only that, these are the same folks when they get the infection, they're going to fall into that unfortunate 3 to 5% of population who are going to unfortunately succumb to this disease and perish and may get sick and get into the intensive care unit. So we are seeing a lot as a cardiologist. A lot of our patients, they're vulnerable, and I'm on phone with them, I'm on virtual health with them, telling them every day to really isolate themselves and try to avoid getting in touch. But the other aspect of things is the routine cardiac care is also suffering. Right now, we are used to. If somebody has blockages in the heart arteries, chances are they may not get life-saving procedures even. In medicine, there is always black and white, and there is a huge gray zone. Unfortunately, that gray zone has gone so much more, and people who are absolutely not dying, if there are any other condition, we are not even fixing them right now. We are not doing their testing in the office. We are not doing stress tests. We are not doing the routine ultrasound to see if they have any serious vascular issue or not. And we keep saying we'll do it when things get better, but we don't know when that's going to be. So frankly, we have patients who happen to have blocked arteries, and we are not able to fix them. So we are being impacted a lot. We are suffering, and our patients are suffering.
And we were seeing that. I saw reports coming out of the UK that they were trying to ration who gets chemotherapy and who doesn't with cancer patients. So do you think something like that could come into play here?
Yes, absolutely. I think rationing of care is something that's going to be a real conversation. It's already become a real conversation for cancer patients and chemotherapy. I think it's going to go into other aspects of medicine. We're going to very soon have to decide, as you heard from many other people in Italy, we saw that who gets the ventilator or not, who gets dialysis or not. Because you got to remember, it's not just that people need these procedures or this supportive care. There is a lot of personnel that goes with it that surrounds this care. We need to have the actual space, the beds, the machines, and the personnel. So this all will be affected. Same way cardiology and cardiac care is 100% being impacted. We are not doing cardiac catheter procedures. We are not doing some of the surgeries that we think could potentially wait. But again, it's cardiac disease. You really don't know how long some of those things can wait. I'm also a vascular specialist, and actually this happens to be a DVT, which is deep vein thrombosis or blood clot in the leg, DVT Awareness Month. And vascular care is majorly affected. We have people who have serious circulation problems, whose quality of life as well as their longevity, both are impacted. And we can't really go and do a whole lot about it because we don't know when it's safe to start reutilizing some of the resources, which are all currently directed towards taking care of COVID-19 patients.
So what would be your advice to these patients that might see their services cut? What do you say to them?
I think seek attention, get counseling, talk to your doctors. I think what we are doing in our practice is we are really individualizing, seeing people's risk, trying to, no one can predict the future, especially in advance, as they say, but we are trying to do that. We're trying to see people today and say, hey, I think you have these issues that really needs to be addressed, but hopefully within next 1 to 2 weeks, you should be fine. And let's readdress, let's reassess you in 1 or 2 weeks. So that's what we are doing. It's in football terminology, we are punting the ball as much as we can and then reassessing them. But my advice is seek attention. If you have symptoms, don't ignore it. And oftentimes cardiac symptoms are mimicking COVID-19 symptoms, and COVID-19 is mimicking cardiac symptoms. So we have also had a number of people who are coming into the hospital with what sounds like heart attack, and in reality, they had COVID-19. So, again, your cardiac symptoms could be due to COVID-19 as well, especially shortness of breath, unusual discomfort in the chest, palpitation, arrhythmias. Don't ignore it. Get in touch with your doctor's office. Most doctors are doing telehealth. They're available on virtual health. So get that help, and get doctor's help to figure out whether you really need to go to emergency room or your best bet is to stay away.
Perfect. Thanks for that. And just quickly, how are you keeping your family safe being a frontline worker? This is a question that we had from Facebook.
Yeah, so again, I want to clarify. Frontline worker term is very specific right now. People who are working in the emergency room, people who are working in the intensive care units, people who are intubating. So our pulmonary colleagues, infectious disease, anesthesia, ER, and all the nurses and support staff who are working in the front line. I am frontline when I have patients coming in with a heart attack or cardiac issues. That's when I go in the emergency room. So, right now, as of now, my exposure is somewhat limited. It's probably going to grow. As one of the very famous cardiologists recently said, we are not cardiologists at this point. We are all COVID fighters at this point. And I think sooner we have that mentality, better it is. So having said that, the only way I can protect myself and my family members and my loved ones is by being extremely cautious, which is PPE, which leads back to the original personal protective equipment issue. I have tried to acquire PPE on my own as much as I can. I have a few masks. I think I have like 8 masks right now with me, which mask and other like regular surgical masks. I have protective gears. Majority of the institutes I go to, they still have 1 mask per provider per day. So we are still getting it, but the buzz is that they're gonna run out of it very soon. So we are all keeping our fingers and toes crossed and hoping that very soon we're gonna see all the social media movement, government, someone somewhere is gonna, I know a lot of people are 3D printing this mask and other protective gears and face shields and shoe covers and head covers, that we're gonna start seeing all of those things coming back very soon.
I hope we see that soon. All right, thank you, doctor. So we're going to take a short break now. We'll be back in just a couple minutes with more questions. So leave them, keep them coming on Facebook and emailing us.
You're watching News 12. Local news, local weather.
Attention cancer victims who use the weed killer Roundup. A federal jury unanimously found that Monsanto's popular weed killer Roundup was a substantial factor in causing cancer. You may be entitled to substantial compensation. If you or someone you love used Roundup and were diagnosed with cancer, call the number on your screen now. Don't wait. There may be time deadlines to file a claim.
Call 800-426-1324. That's 800-426-1324.
News 12 is brought to you in part by Raymore and Flanagan. Surround yourself in style.
Tired of your old frying pan? Well, stay tuned to get a free state-of-the-art frying pan from Gotham Steel. Yes, you heard us right. Free.
Hi, Chef Daniel Green here with Gotham Steel, the newest technology in non-stick cookware made with ceramic and super strong titanium. Stronger than ever before. It's literally like cooking on air. Everything slides right off. This pan makes cooking so easy. Check out this s'mores recipe. Start with chocolate chips, add sweetened condensed milk, marshmallows, and then bake. That's right, use Gotham Steel in the oven to up to 500 degrees. And then look, it slides right out. Delicious. And it's dishwasher safe. Watch, you'd never whisk eggs in a non-stick pan, right? Well, you can with my pan. Use metal and look, no scratches. No oil or butter, absolutely no sticking and no scratches. It's amazing. Look, burnt cheese is a frying pan disaster. Not with my pan, shredded Parmesan, right on the heat. And here's a secret. Shape a bowl for a unique way to serve party dips. Even fire won't damage Gotham Steel. Make steak fajita flambe with ease. No burnt stuck on mess. Just a clean pan and flawless food every time.
We want all of America to try this revolutionary new pan, so here's an insane deal from Gotham Steel. Get your 9.5-inch Gotham Steel pan with new titanium ceramic surface for just $19.99. But wait, call now and through this special TV offer, you can get a second Ceramic pan free. Plus, you get your shipping absolutely free. And we're so sure you'll love the non-stick, non-scratch surface, we're giving you a huge 90-day money-back guarantee. Call now to get your Gotham Steel non-stick pan for just $19.99 and get a second pan free. Plus, we'll even ship it to you free. Here's how to order.
Call 1-800-790-2491 or go to GothamSteel.com. That number again is 1-800-790-2491 or visit GothamSteel.com. Call now.
I remember the shock that I felt when I was told that I had prostate cancer. I put my trust in God first and the Winthrop CyberKnife team and their fantastic track record. With CyberKnife, I experienced no pain and no side effects. I think about the guy that was just told he has prostate cancer. I want to give him and his family hope. I'm a witness that CyberKnife works.
NYU Winthrop CyberKnife is now part of Perlmutter Cancer Center.
During this health crisis, children suffer the most. To help, go to givemore2save.org.
Vascular disease specialist and founder and director of Apex Heart and Vascular Care. So thanks for being with us.
Thank you. Thank you so much, Jan. I appreciate it.
So we did have a question from Facebook that was asking if when people go out, when they come home, should they immediately change their clothes? So what do you think about that?
I think so. It's always a good practice. It depends on what it really doesn't depend on what you did, because right now, if you are anywhere in the world, especially in the more endemic areas like Tri-State County, chances are, you probably touched something or you got exposed to something. So it's always a good idea to come home, deep wash your hands. As far as taking and change your clothes, as far as full shower goes, it's up to you. It depends on what you really did, where you were, what you touched, and all that stuff. Remember, the virus can, now we are learning more and more. The virus can go, we used to think it's only 6 feet. Now there are new studies coming out from MIT saying it can go up to 27 feet far away from one person to the other person when they sneeze or coughs. So right now, the whole social isolation distance guidelines that we are following from 6 to 10 feet, they're based on data from 1930s. The new data are telling us that you gotta be even more socially isolated and social distancing. So we're gonna see what the new recommendations come out. But right now, great idea to come home and change your outfit and clothes and shoes also, by the way, because the droplets can live on the shoes as well.
Thanks for that. Okay, so now the White House has given approval to try hydroxychloroquine on coronavirus patients, but there is some concern about potential cardiac arrhythmia from taking that and Z-Pak. So what can you tell about the cause and effect and about that issue?
Yeah, so it's a very serious side effect that unfortunately hydroxychloroquine and azithromycin can give. It causes something called QT prolongation, which means it increases the amount of time in which the heart muscles relax, which in turn exposes the heart to getting arrhythmias. Not everyone gets it, but if you have a baseline thing on an EKG called QT prolongation, you can get this serious arrhythmias. And sometimes when people take first dose, we need to repeat the EKG. So here's what I would suggest. I would suggest before if you are a cardiac patient or if you have risk factor for heart disease, make sure you run it by your doctor that do you have risk of arrhythmias. Make sure you at least have had a baseline electrocardiogram and EKG, and you can even get it done remotely now. There are a lot of apps you can, there are a lot of Fitbits and some of the smartwatches. You can get your baseline QT interval on your EKG. It's a simple measurement that tells you what's your risk. If you don't have risk, then you can go ahead and take it and then not have to worry about it. If you are somewhere in the middle, borderline risk, then you take it and then you repeat the EKG and make sure you didn't get that impact on your baseline EKG. But if you happen to have prolonged QT to begin with, then it's not a great idea for you to consider hydroxychloroquine azithromycin right now, especially since the whole recommendation of these medications are not very strong to begin with.
Right, and we did have a question from Facebook as well. So should patients who use biologics like Humira continue their medicine or stop until this whole thing is over?
Yeah, so there is no literature or data available. I think right now, if you are on Humira, you should continue it. There is no reason why you should not continue it. Just again, you gotta be very careful and about being very, very strict about this social isolation and social distancing, because you don't want to catch infection if you're on something like Humira. And these are the things you definitely should run it by your doctor. Make sure you get your EKGs and check your QT intervals and stuff like that.
And another question from Facebook. This person says that they have been quarantined for the past 2 weeks and so have members of their family. They want to know if it's safe to see each other, if they're all feeling fine, or to still just stay distanced.
So they had infection before and now, or
I think they were just in their own homes, in separate homes for 2 weeks, say they're feeling okay. Should they still distance
I think
themselves?
Right. So I think if it's a small number of people and then you could potentially, keep distance away from each other, keeping, guidelines say 6 feet, I would say 10 to 11 feet distance within the same confinement. There is no major reason why, medical reason why you can't do it. Having said that, I think at this point, every citizen, every person has a bigger responsibility than looking at their own self, and which is community interest. And I think as far as the community interest goes, which is the statistical stuff, we need to understand that more people see each other, more they get in touch with each other, the likelihood of contaminating and transmitting is always gonna gonna go up, because people have to, go from one place to the other place. They have to use modes of transportation, whether it's using a cab, Uber, whether it's using an elevator and touching the elevator door. There are multiple ways where this transmission can spread, and we are still learning about it. So more you can avoid and ignore, better it is. That's my advice.
And just quickly about that, would you recommend people use like tissues to open doors if they are out, or push elevator buttons and stuff like that?
I think so. I think intuitively it makes sense. We don't know how protective it is. As long as you are not taking that tissue and touching your own face, use it and throw it away. I think it should be fine. Or wear like gloves that you use them and then you take it out as soon as you get a chance. But again, those gloves are going to be in shortage, so use them judiciously.
Perfect. And of course, washing your hands. So that's still an effective kind of thing in combating transmission?
Absolutely, 100%. Yes. No, absolutely. Wash your hands and learn the proper hand washing technique. Again, we are hammering this point that, remember, you don't need Purell or hand sanitizers. Just regular soap and water is good enough. And I think proper hand hygiene should be around the year. It's not just COVID-19 specific, in my opinion.
Yeah, I feel like that'll be something that people kind of take with them when this does get over that hurdle. Of course, so we're going to take a short break in just a couple seconds here. So Dr. Shah will be joining us for one more little block that we have with us. So you can keep your questions coming on Facebook. You can also email them to us. So if you have anything you'd like us to ask, definitely let us know and we will forward them right to the doctor. Stay with us.
Ripped pants, moth holes, torn kids' clothing. What can you do? Don't fuss with messy glues, heavy sewing machines, or old-fashioned needle and thread. Ditch the sewing and make the switch to No Stitch. No Stitch is the easiest way to hem, mend, and fix your clothes ever. Just sprinkle the specially formulated adhesive powder on the fabric. Apply the heat wand, and it's secure in seconds. No Stitch is like sewing without the sewing. Need to hem a pair of pants? No problem. Fix a torn shirt? No problem. Important job interview and you need to get out the door? With No Stitch, it's no problem. You can fix any clothing quickly and easily. No Stitch is unlike any other repair kit. Make a mistake? Just place the heat wand on the fabric, and like magic, the hem comes undone so you can make it perfect. With glue adhesives, you need to wait forever. But No Stitch turns that same tear into an easy repair. And No Stitch is so strong it will never dissolve or come loose wash after wash after wash. No Stitch works on any fabric, from heavy denim to delicate silk. But No Stitch does so much more. Rip curtains? Say it ain't so. With No Stitch, they're as good as new in an instant. Burn tablecloth? No Stitch fixes it quickly and easily. No Stitch comes with a No Stitch heat wand and a 3-ounce bottle of adhesive powder for only $19.99. But wait, order now and we'll double the amount of adhesive powder to a full 6-ounce bottle, enough to repair hundreds of garments, absolutely free. Ditch the sewing and make the switch to No Stitch, the easiest way to hem, mend, and fix your clothes ever. Order yours now for only $19.99.
Call 1-800-219-2693 or go to trynostitch.com. This offer is not available in stores, so call 1-800-219-2693. That's 1-800-219-2693 or order online at trynostitch.com. Call now.
Toyota's family stretches to every corner of this country, so you can trust us to be here for you as we remain committed to supporting our community. Because the Toyota family is stronger together. This is our pledge. We are here for you now and in all the better days ahead. Our service centers are open and here for all your needs. Ride safe. Toyota.
News 12 is brought to you in part by Raymore and Flanagan. Surround yourself in style.
Welcome back to our coronavirus special. We do have Dr. Shah with us for a little while longer. So, Doctor, I guess people now are seeing nurses and doctors on the front line and, the shortage of PPE like we mentioned before. So how can people help that aren't in the hospitals?
Yeah, I think, it's difficult to be on the sideline and see this catastrophe happening to your loved ones. I'm sure everyone knows someone in their friends or family circles or someone who's working as a healthcare worker, probably at the COVID frontline worker, and they are in dire stress. There's going to be, we often say in the hospitals that there's going to be PTSD, and there's going to be psychological disorders and anxieties and depression that's going to come out, that healthcare workers unfortunately will have to face for years. But for now, everyone's focused on fixing and working against this crisis. I think it's important because what happens is the world is divided. There is like half the population just sitting home, following the rules, following the isolation. They're in quarantine and they're bored. And their biggest problem is how to deal with their boredom. And they don't see this crisis because they are not on the battlefield, so they don't know what's going on. On the other side, we have the healthcare workers, who are in the hospital, and they're frustrated and exhausted and tired and depressed because what they are seeing. If you're in the first category, try to help healthcare workers. Helping your local grocery store. If you're a small restaurant, a lot of restaurant people are actually giving free food to healthcare workers. But I think the biggest, most impactful help could be joining the movement in getting the healthcare workers the PPEs, that they so truly deserve and need. Join the movement. There are multiple organizations. There are GoFundMe campaigns. There's an organization called GetUsPPE.org.
All right, Doctor, sorry to cut you off. We are heading out of here. But yeah, look on social media, see how you can help. We'll be right back.
Thank you.
News 12 Time and Temperature is brought to you by the Westchester Bank. Experience